Mast cell activation and breast implant illness. Today we have Dr. Kelly McCann. She's really going to dig into mast cell activation syndrome and its possible links with breast implant illness.
There is a paper that came out of Australia last year, now that it's 25, about the link between breast implant illness and mast cell activation. And it's really very impressive. When patients who thought that they had breast implant illness got their implant out, within 2 weeks, their symptoms declined by like 75%. And at 9 months, it was almost 85%. And even in the group that had their explants done, who did not believe that they had breast implant illness, they actually had a 70% reduction in their symptoms as well. So what does that tell us? It tells us that silicone breast implants are causing mast cell activation, most likely in a lot of people, even if they're not aware of it. It's upregulating the immune system and causing issues.
Yeah, let's talk about that because I told you before we were together at a different meeting that I had people come to me self-referred with breast implants who had been clinically diagnosed with mast cell activation syndrome, which to me was relatively, obviously I knew what mast cells were, but I was not really keen on what mast cell activation syndrome was. So maybe just for the audience, how do you, after working for a decade in this space, how do you come to the conclusion that someone has that? What tools do you have to tell them that they have that problem?
So it's a syndrome that has a lot of components to it. Basically, you have symptoms in many different systems of the body that are allergic, inflammatory, or kind of growth related. So it can present in a wide variety of different ways. Some people will get fatigue, they'll get allergy symptoms, skin symptoms, gastrointestinal issues. They may have cardiovascular symptoms, POTS. They can have neurological symptoms, psychiatric symptoms, kind of like, and then of course, a lot of symptoms around the breast. You can have lots of inflammation and pain, but you don't have to. The challenge with mast cell activation is that we all have mast cells. Mast cells are part of the immune system, and their job is to identify and fight foreign invaders. They're born in the bone marrow, they move to the periphery, they live in the areas of interface between ourselves and the outside world. So like our nose, respiratory tract, GI tract, they live around our nerves.
So that's really important. That's really important because the triggers can be just a host of things. And maybe that's the thing that, to me, when these patients came in, they were telling me potentially triggers. And so like anything can be a trigger. So
Absolutely.
Obviously we operate on patients, a medication, something that may contact the surface of their skin can trigger them, because obviously we know about things like latex allergies, there'll be drug allergies, but like these are diverse triggers, right?
Absolutely. Because the purpose of the mast cells is to constantly look for foreign invaders, what they perceive to be foreign invaders. So this could be a misperception, right? That's the whole idea, is that people who have normal mast cells and not mast cell activation syndrome, their mast cells are looking for infections, they're looking for toxins, they're looking for ways to protect the body. But in a certain percentage of the population, probably roughly 20% of the population, they have mast cells that are more hypervigilant, right? They're more sensitive. And when they see a foreign invader, they're going to get triggered. The triggering event then causes a release of these mediators that are in the mast cells. Those mediators are often inflammatory. So you've heard about the cytokine storm with COVID. That's a mast cell event. That's dumping all these inflammatory mediators to help the body fight the foreign invader, right? And when we put an implant in, that's a foreign object in the body. And for those people who have these mast cells that have a tendency to be hyperreactive, they're going to react all the time. And then you start to have this cross reactivity with other things. So the food that you eat, the medications that you take, the supplements that you take, the air that you breathe, the perfumes that you wear, all the personal care products, the things that you put on your skin, people start to develop more and more and more sensitivities. And unfortunately, if the primary trigger is the breast implants, they can remove them and reduce their symptoms a great deal.
So when was the first documented case of mast cell activation syndrome?
The first paper came out in 2007.
So let's just start there. So I get this a fair amount, and this is that everybody's super clear about this. Autoimmune disorders, mast cell activation syndrome, all these typical kind of things that are associated with, but not exclusive of, patients who have breast implants, all started before or after breast implants. So autoimmune disorders like Sjogren's syndrome, lupus, etc., found out in the late 1800s. Things like Dr. McCann is discussing mast cell activation syndrome. She's talking about 2007. Obviously, it was
there a long time ago, right? So in the 40s and 50s, people talked about multiple chemical sensitivity. And there was a doctor out of Dallas, Dr. Bill Ray, who had an entire clinic devoted to environmental medicine, right? And so doctors who have been practicing environmental medicine for decades and decades are familiar with multiple chemical sensitivity. And then recently, a PhD named Claudia Miller worked with Dr. Larry Afrin and Tanya Dempsey, who are leaders in the field of mast cell activation. And they wrote a paper together and really solidified the idea that these two conditions, whether it's mast cell activation or multiple chemical sensitivity, they're very, very similar. Now, you can have mast cell and not chemical sensitivity, but not often.
But don't they, and maybe, because I'm not familiar with that paper, or if in that paper they discuss genetic predisposition to problems with detoxification. So if you can't detoxify well using the antioxidant glutathione, you're going to be very sensitive to chemicals, perfumes, environmental toxins in general, because they're going to accumulate and you can't cope with it. You're going to exceed capacity very, very quickly. And then you'll become what we see as someone who's got symptoms of chronic inflammation.
Right.
And that's what we see.
So as I mentioned, roughly 20%, 17 to 20% of the population has mast cell activation. And those studies in the genetics came out of Germany. And the thought is that I think it's really multifactorial. And what happens is that we have a predisposition, like I'm an allergic kid, my mom's an allergic person, she's got celiac disease. So, right, I have mast cell activation because of mold. And what happens is that people who have this genetic predisposition get repetitive hits. So it could be a mold exposure, it could be Lyme disease, it could be EMF exposure, it could be a specific toxicant exposure, like you lived on a farm right next to a bunch of farmers who used a lot of pesticides or something like that. You live next to a golf course and they're spraying pesticides on everything. So these what I'm calling hits, exposures, then kind of ramp up the reactivity of the mast cells over time. And then you put it in a foreign body like a breast implant, and now the mast cells are going crazy because they never get a break. They keep seeing that implant as a foreign invader and are continuing to have this inflammatory response.
Right. I mean, that's what we talk about routinely. And I joke about it, but you can't pick your parents and you can't outrun a bad diet. Where you grow up. And Dr. McCann is saying it, but not saying it out loud. Like the specific chemical spread on golf courses that got outlawed in, I think, 2004 maybe, was atrazine. And then the chemical in Roundup is glyphosate, which is basically, I have clients who grew up in the Central Valley of California who ran under crop dusters that were spraying the fields as kids. And so they have tremendous amounts of that toxin in their system, which is, and Dr. McCann can elaborate on it, but any of those things can be neurologic disruptors. They can be endocrine disruptors. Anything that's doing those has those manifestations in our body certainly is going to ramp up our immune system and cause more problems with mast cell activation, which she hasn't even got to why all the bad things happen when a mast cell gets upset, but she's going to tell us exactly why that happens and why people get so unwell after.
You want me to talk about that next? Okay, so the mast cells are pretty little cells. They are filled with all these granules of chemicals. And these chemicals may be things like histamine, serotonin, they're enzymes, they're cytokines, chemokines. They are also growth factors. And we have different combinations of mediators in different organs in the body. And each person's combination of mediators is different also. So the mast cells and the composition of the inflammatory mediators that are in my mast cells in my skin are different than the ones that Dr. Rob has and that are in his skin. So that's one of the reasons why mast cell activation looks like everything, and it's so complicated, and each person looks very, very different. But what those mast cells are doing is trying to protect you, right? Because as I said, their job is to fight foreign invaders. And when they release their mediators, when they perceive a threat, what they're doing is they're calling other components of the immune system in to help deal with that threat. And unfortunately, we're the innocent bystanders of our immune systems trying their best to help us. So it's unfortunate.
Yeah, just like you said, like you go back to the foreign invader aspect, which is, I always try to enlighten folks when they either on my show or I have a chance to talk to them about surgery in general. And so surgery has a unique position in that it demonstrated tolerance. So the surgeon who won the Nobel Prize, Dr. Joseph Murray, transplanted a kidney from one Siamese twin to another because they had the exact same immune composition, because that's the only way you can do that operation and not have rejection, which is what Dr. McCann is really ultimately talking about, tolerance. So when you put something in that's not your own, so we often hear, and whether it's a famous influencer, oh my God, let's take, what influencer do we want to talk about? Whether it's Gary Bragg or anybody's talking about peptides or exosomes, which recently was talked about by Brigham Bueller on Joe Rogan's podcast, like peptides, right? Now, and that's not probably the best example, but peptides are amino acids. And in this setting, those are synthetic. So we did those, and even with those, you can get little skin reactions. So if you're a mast cell activation syndrome patient and you think you're going to get put on compounded tirzepatide or compounded BPC 157 with whatever, because the recent warnings of the FDA about peptides. So there's autologous, which is your own, basically. And there's something that's allogeneic. And then there's something, like we're discussing now, which is a completely foreign substance you're putting into somebody. So whether it's I always use the knee, hip, breast, dental, cardiac, neurologic. I think for everybody listening who doesn't know anything about my career, I did 6 years of general surgery, 2 years of plastic surgery, a year of oncologic reconstructive surgery. And I helped every surgeon who operates, who puts in a foreign body at one time or another in my career, help take care of a problem created by or an extrusion of a foreign body. And that's just the nature of doing that kind of work. And mostly the work that I did was with respect to cancer reconstruction. But all those things have reactivity. Right. And looking back throughout my career, why patients would have different intervals of, we'll just say, recovery. We're not taught in school about functional genomics. In fact, the Genome Project wasn't even complete when I was in medical school. It was more of a big idea, so to speak.
Pipe
And
dream at
then
that point.
yeah, with computing. So everybody listening should understand, like, the reason we have what we know about genetics is because computers got better. Without computers, we're still just sitting around drawing little charts and family trees trying to figure out what's going on with you. So with computers and the advent of computing, there was a documentary produced about the BRCA mutation. So it's called Decoding Annie Parker. But ultimately, your genetics, not to get too tangential in this, they set up the playbook, and then your exposures, and this is a very specific exposure that we're talking about with the addition of a breast implant, whether it's for cancer or cosmetic purposes, that is irrelevant in this situation. So once you introduce that into the person, your immune system forever is trying to get rid of it.
Right.
100% of the time, all day long, every day, 365 days a year. I mean, it's
Exactly.
trying to get it out of your body.
And for those people whose immune systems are already revved up from genetic predisposition or other exposures, it is going to send you into a spiral that we call breast implant illness or implant illness, or where you're not tolerating that thing anymore. One of the things that I wanted to say was there's a theory, a way of talking about environmental toxicant load from an environmental medicine perspective that we call total load, right? So everybody's body is a sink. Some people are born with ginormous sinks and huge drains. That's your ability to detox. And you can stuff all sorts of things in that huge bucket, right? These are the people that party like rock stars and drink and smoke and then die peacefully in their late 90s instead because they were able to deal with all the toxic exposures that they had. And then there are people who have really shallow sinks and very narrow drains. These are the people who get mast cell activation. They get a mold exposure, environmental toxin exposure. I mean, the truth is, like, we're bathing in chemicals all the time, every day. And if we have a larger exposure or a genetic incapacity to manage that, we're going to get symptoms. Usually the first symptoms that show up are immunologic symptoms, and that can be autoimmune or hypersensitivity. So you've got like two sides of the same coin. The autoimmune is going to be where your immune system attacks your cell, right? Where your immune system has that mistaken signal. Or you could get a hypersensitivity reaction that might be an allergic reaction or a sensitivity, and mast cell is on the spectrum. And then as you accumulate more toxins, I was always taught that then you start to get neurological issues and then endocrine issues when we're talking about environmental toxicant exposure. So bisphenols, BPA, phthalates, some of the pesticides, some of the mold toxins and mycotoxins actually are endocrine disruptors. There are a ton of endocrine disruptors out there. And those are adding to the bucket and causing problems. Certainly, an ability to detox is also part of the equation too. But most of the time at this point, we can't just take glutathione or sit in a sauna. For some of us, that's not sufficient, right?
Right. I'm glad you brought that up. So everybody listening knows I have some strong feelings about sauna, especially with implants in place. So I get asked this, like literally I was asked this at this meeting I was at, can I do the sauna, Rob? Or can I do this, Rob? And so extreme temperature elevations will certainly cause probably mast cell activation or enhance it. So you don't want to do that. And if you have implants in place, I've had patients have significant Herxenheimer type reactions from sauna sessions. And the whole point being is, like, nobody did a trial with breast implants and stuck you in a sauna, randomized you to see if you would do okay if you were in the sauna versus somebody who wasn't in the sauna. And it wouldn't matter anyway, because in the beginning, why would it matter? Like, something that's brand new, if we just say that it's brand new, unless you had the lemon law, like a completely defective device from the jump, you wouldn't have a problem. Like, when people ask me, like, when does this start? All right, Dr. McCann, when can mast cell activation start? Well, I always say kind of the same things. Like I just said, you can't pick your parents. So we don't know how you detoxify. I've looked at genetic sequences on my patients. I have a very strong profile of who gets the problem given a certain set of circumstances. But then the air you breathe, the fluid you drink, food you eat, the products you use on your skin, your stress levels, your sleep pattern. Oh my gosh, we ain't even talking about the sleep. So my favorite thing is to figure out how to hack my sleep better. So
Right.
all of those things are contributing to your bucket that you were talking about and how you can manage it. And no, you can't take glutathione and solve all these problems. And you can't get in the sauna and take a binder and solve that problem. What else? What else do I get asked about?
Colonics, coffee enemas. I mean, not to say that they don't have their place. I don't know how much you talk about those things, but
it's interesting that the folks who have the most the mold exposure patients, like people who've been exposed to mold, as you have tons of trouble, and including but not limited to extreme fatigue in certain instances. That I don't know if I could ever fathom not feeling like I could get up and get out of bed. Like they describe it as they just don't have the will or the energy or the motivation to get up and get out of bed. Now that's awful. And I've had people just I've had people just tell me that if they didn't have that combination of whether it's a clonic or a coffee enema, which I was like, okay. I mean, obviously, like any drug delivery can go through a mucosal surface. So of course there's rectal medications and yeah, you would get a huge jolt of caffeine that way.
yeah,
That'll help your mind.
it's more than just the caffeine though. I mean, colon hydrotherapy, colonics have been used in environmental medicine for a long time. And it's not about the poop. It's really about the stimulation, whether it's the coffee or the stretching of the colon wall with the water in the colon hydrotherapy is stimulating the gallbladder to dump bile. Bile is where a lot of our environmental chemicals hang out and mold, and you can even get it filled with infection. So if you dump a lot of bile into your gastrointestinal tract by using these methods, it actually is enhancing the excretion of these toxins into the toilet. And you're overwhelming your enterohepatic recirculation, which pulls them back in. Because when we eat and we get a bile dump when we eat, the body is really efficient. It wants to pull that bile back into the body, right? So that's the enterohepatic recirculation because it's expensive for us to make bile. So we want to hold on to as much of it as we can. But then we're pulling back in the mycotoxins. We're pulling back in all of the chemicals, all the toxins that are in the bile. Because remember, many of them are fat soluble. So the coffee enemas and the colonics help get more out than you can possibly reabsorb. And so that's one of the reasons why they're suggested in environmental medicine. But they're not really that much fun to do, although they can be incredibly helpful for people.
Yeah, let's summarize that so that everybody gets. That's a lot to say and unpack very quickly. But so you're cheating the normal time to eliminate waste by stimulating it. Mm-hmm. And just like if we gave somebody cholecystokinin and got them to dump bile, so the bile salts are what get reabsorbed in the enterohepatic circulation, and that's where the mycotoxins are typically bound. So if you can, the cheat, if you will, is get it out before it can get reabsorbed, is so to speak. And that's why those patients are doing better. And even if I always worry about they're just constantly getting re-exposed either through the air that they're in or maybe the home where it has a leak or something, or at work. People work lots of places that, or they have to go from place to place. I have all sorts of folks in construction and real estate who just constantly get exposed to things because of the nature of their work. So I think those are great points in terms of how to help eliminate, right? I mean, that's basically you're eliminating fast So then you're allowing your body to reabsorb the bile salts, and that way you can eliminate more mycotoxins. So, I mean, that all makes perfect, if you want to think of it like biologic sense. And then you get the benefits. I never discount the help of caffeine. I'm a big believer in caffeine.
Oh, well, if I didn't have my 1A2 or 1A1 double homozygous SNPs and could tolerate caffeine and sleep.
You get too much out of caffeine.
Oh yeah. Caffeine will, if I have caffeine at 7 a.m, I won't sleep very well at night. So sad to say, no more caffeine
That
for me.
active CYP A1 ...
Yeah,
That
exactly. Yep.
that's what I don't have that.
You're clearly you don't have that.
No. But what you said was very important too about, since we were on the gut. So if you have a big problem with mast cell activation and vis-a-vis you're going to have more and more histamine release, you're going to get lots of problems with gut, leaky gut syndrome, probably dysbiosis.
SIBO.
What does that look like?
Yeah, SIBO. So sometimes it's difficult to tease out, right? Because people who are mold exposed have all these symptoms. People who have mast cell have very overlap symptoms. You get leaky gut, the peristalsis slows down. People have bloating, gas, heartburn, diarrhea, constipation, alternating. They get labeled with irritable bowel syndrome, which is a useless term because it doesn't tell us how to get you better. But so many of my patients with mold and mast cell also have small intestinal bacterial overgrowth. We're supposed to have bacteria in our colons, not in our small intestine. And when the peristalsis is not appropriate, things get backed up. Bacteria decide to set up housekeeping in the small intestine and cause a lot of grief because as you eat, they're going to ferment your food and create gas, and that creates all these symptoms. And so with a mast cell patient who is mold exposed and has SIBO and maybe breast implants, trying to figure out like, what's the order? How do you get things better is really tricky. And you have to work with a functional doctor who understands and sees all the potential problems and addresses them in the right order. So for some of my patients, it is absolutely, we got to get out of the mold first, right? Nothing's going to work unless you're out of the mold. And then for a lot of people, we have to treat the SIBO. And additionally, when people are in mold, not only can they get SIBO, they can get small intestinal fungal overgrowth or just fungal or mold colonization in general. So maybe you've got a breast implant and now you're colonized with mold too. And that doesn't have to be in the breast implant. That can be in your sinuses. It can be in your GI tract. And so figuring out and treating the mold and or fungus that's there is also an issue.
Yeah, let's just talk about mold because I get a lot of messages or there's a lot of misinformation about mold and breast implants. And so we published a paper last year looking at over 600 consecutive explanted specimens, and the predominant species was bacteria. In our series, it was Cutibacterium acnes followed by Staph epidermidis. And in the first 1,000 cases I did, there was only a handful, like 5, that had fungus. So for everybody listening, I don't want you to feel like mold is coming from your implant. If you got a test that said you were mycotoxin positive, either on blood or urine or muscle, whatever the modality, air, it is not coming from your implant. If that provider is telling you that is almost uniformly not accurate advice because they can't tell you. And two, I published a big paper just to prove the fact that that's not the issue because it was getting talked about. It's lovely TMZ material to show what they consider to be a moldy implant. People go on to talk about it and it's just a bunch of bullshit. That's not the issue at all. It's bacteria, and it's the bacteria most commonly found on your chest, shoulders, face, and neck. Cutibacterium acnes, and then in general, a common bacteria found all over the body, Staph epidermidis, that readily produce biofilm. So the biofilm allows protection really for the bacteria and difficulty for your immune system to surveil it and take care of it, which probably further upsets the mast cell situation. And for us, I would hope at some point there's science that's shown that the interaction between the bacterial biofilm on the device, so up against your scar tissue, and the breast tissue, specifically a fatty acid in the breast tissue called oleic acid, becomes oxidized. Now, for everybody listening, if you have too much oxidation, that's a problem. You want to have more reduction. So if you have too many oxidative type situations in your body, you get too many what we call free radicals that's hard for your body to deal with. And that creates more stress. And we refer to it at a cellular level as oxidative stress. So like think of like you're working out hard. And if you don't methylate well from a genetic standpoint, you stay sore for a longer period of time. So we know that this interaction happens and produces a molecule called oxylipin-10-ho. There's no test for this yet. I mean, I know this because we know the scientists who perform the studies, and I've talked about it on my shows. I've interviewed the scientists. The work's published. I mean, there's no confusion to me anymore about the cause and effect. Now, that's only in those patients who happen to have, we'll just say, those bacteria, and it's causing that interaction. Now, does that explain everything? Of course not. But just in general, that gives you roughly a third of the patients that I take care of and explant with that issue. So what's going on in the other 71%? Well, as you can imagine, it's a combination of all the things we've been discussing on the show. It's your genetics, it's your diet, it's your environment. It's all the things that you get exposed to on a day-to-day. And it's a lot to cope with. I'm sure Dr. Kelly can commiserate with me. It's a lot when your patients have and start listing all the different symptoms. And now it's just whether it's a particular set of symptoms in a system like your nervous system or your musculoskeletal system. Like the list is long and it's quite diverse, and it confuses a lot of providers. And I don't envy anybody trying to take care of a patient with mast cell activation syndrome or chronic inflammation in general. I will highlight that people don't ask a lot if their patients have breast implants. I hope that's changing, because you need to know, as a provider who may be listening to this, whether or not a patient has an implant of any type anywhere in the body, so that you can better understand the potential interaction.
Very good point, Rob, Dr. Rob. I did want to circle back to like the biofilms from these organisms, and in the mold world, we get a lot of issues potentially with biofilms. So, for example, I have had a bunch of patients who've been mold exposed. We do some nasal swabs looking for, or even urine testing if they have urinary symptoms. And what we're looking for is bacteria and or fungus by next generation sequencing, which is the creme de la creme way to look for bacteria and fungus. And we're finding a lot of different kinds of staph, different kinds of Propionibacterium acnes, and fungus in nasal passages of people who have been mold exposed. And then they're creating these biofilms in the nose, they're creating biofilms in the bladder, they're creating biofilms around the breast implants. And in order to help support the immune system, we're treating with biofilm busters, different kinds of proteolytic and fibrinolytic enzymes to break those up. And that's really helping the immune system then clean up what's in the nose. And remember, those mast cells, they're constantly surveilling for foreign invaders. And those foreign invaders include not just things like toxins and implants, but they're also looking for bacterial infections and biofilms. And so there does seem to be this relationship between mast cell activation, biofilms, mold, etc. I had one woman, we've been treating her for mast cell activation. We did the mold thing, we did SIBO, we did Lyme, Bartonella, etc. And she was still having a lot of rashes. And when we started going after the bacteria in a biofilm in her bladder, all of her symptoms got so much better. So I do think.
So that was on NGS of the urine that you found that it was in the bladder.
Yes. Yes. And you can find it in a lot of different people too. That next generation sequencing is not something that most providers do or are cognizant of. The gold standard of urine culture, it's like, I don't know, a century old. That's crazy in the world of AI and quantum computing that is our gold standard. We should really be doing next generation sequencing on everything. It's my personal bias. And then these biofilms in genetically susceptible people who are also hypercoagulable, that becomes reinforced. So on the bacteria side, the bacteria making biofilms. On the human side, people who have a tendency to make clots are reinforcing that biofilm, making that biofilm even more resilient and resistant. And what I'm finding in many, many, many of my mast cell patients is that they are also hypercoagulable. Maybe not factor V Leiden, but there's another gene variant called plasminogen activator inhibitor 1. I'd say, gosh, I don't know, 90+% of my patients who have mast cell also have this hypercoagulation, and it seems to be associated with cardiovascular family history. So if people have a family history of stroke or heart disease, they will often have this hypercoagulability, which reinforces the biofilm, which makes everything harder. And then there's more stuff to inflame those mast cells.
Well, I agree with you going back to NGS. So for everybody listening, in 2019, we switched to next-gen sequencing for all of our sampling of explant specimens. So we have the largest experience with NGS in the world on that. And that's what we published. So, and when we have a problem with a refractory urinary tract infection, or if there's a question, I don't default to what Dr. McCann knows is very antiquated, which is a swab culture. We will always either do NGS preferentially, or we'll send both, because with NGS, you don't get a antibiotic sensitivity pattern, which in some cases is necessary, obviously, for treatment. And you'll send a regular culture just to try to get some information regarding that. In terms of genetic mutations that contribute to hypercoagulability, certainly having an MTHFR, which about 40% of the population does, contributes to hypercoagulability. In fact, I would not do microsurgery on anybody who has I stopped doing that in 2000, maybe 17, 18. Anybody who had MTHFR mutations, I would not offer microsurgery to because of the increased risk of microvascular complication. So I agree with you. Like, the devil's in the details always. And I hold a really, really strong conviction that if you understand your genetics better, it becomes much easier for both you and your provider, obviously, to take care of you. But then you can navigate a pretty complex world a bit better if you understand those things. So, man, it's been a great chat with you today. And I want to make sure everybody can find Dr. McCann. So I'm going to let her tell you her social media handles, her platforms that you can follow her on to learn more and maybe visit her.
Thank you, Dr. Rob. I am in Southern California. I have a brick and mortar practice. You can find me at thespringcenter.com. You can also find me on social at Dr. Kelly McCann. So I look forward to seeing what happens with all of this. I think that mast cell activation and breast implant illness, there's such an overlap and such a need to understand this. So thank you, Dr. Rob, for having me. And it was a pleasure speaking with you.
Thanks for hopping on.